Today we're going to talk about measles matters and what Louisiana healthcare givers must know. The measles is caused by the rubeola virus. It is extremely contagious. It can linger into the air for up to 2 hours after an infected person has coughed or sneezed. The transmission rate, 90% of non-immune people exposed will be infected. So why are we talking about measles? Like why are we bringing this up? So we have had a couple of cases. In 2023, the CDC confirmed 121 measles cases in the United States. As of early 2024, there have been 25 plus states, including Louisiana, that have reported cases. 9 out of 10 unvaccinated people exposed to measles will become infected. Measles is very, very, very contagious. It's one of the most contagious diseases known to humans. So who is at risk? So talking specifically to Louisiana, 92% of kindergartners statewide. Now, this is from a report that was done for 2022 to 2023. Some parishes report rates are as low as 83%, especially in those rural areas. Approximately 2.3% will sign a waiver for religious rights or religious beliefs. And infants less than 1 year account for nearly 60% of the measles cases hospitalized during the outbreak because they are too young to be vaccinated. Now, it is very important for healthcare workers to recognize the early signs and symptoms and notify the healthcare providers immediately. So we're going to talk about some of those signs and symptoms. Some of them are high fever that may spike 104, cough, runny nose, red watery eyes, a rash that breaks out 3 to 5 days after symptoms, tiredness, might experience sleepiness, loss of appetite, very, very fatigued, sensitive to light, and spots on the inside of the mouth. These spots are called Koplik spots. You may have conjunctivitis, pink eye. So with measles, your most contagious time is from 4 days before to 4 days after the rash appears. And this could be very, very, very dangerous, especially to babies and children. So here's what measles look like. You have the conjunctivitis here, the red eyes. You also have the rash all over the face and body. You can see the little specks on the baby's back that looks like some little small bites. You can also have them on your hands, all over your face, pretty much all over your body. The palms of your hands, soles of your feet. Measles complications. So some of those complications are diarrhea, dehydration. You might experience ear infections. And from the complication from the ear infection can cause some hearing loss. Could have pneumonia. Some neurological complications will be seizures and encephalitis, which is brain swelling, or even in some cases death. What should caregivers do if they suspect measles? Well, the first thing you want to do is you want to isolate the patient immediately because measles is an airborne disease, so you want to follow airborne precautions. Get an N95 mask if available. If none is available, I suggest that you get a mask and maybe double mask. You want to notify the healthcare authorities, so the public health. Report symptoms to the doctor, the nurse, or the public health. Do not allow other patients or staff near until clear. You want to make sure you're disinfecting surfaces and any shared items. Check and update immunization records for patients and family. do not wait for the rash to appear before taking action. If you're having these symptoms, or if you notice the patient is having these complaints or these symptoms, make sure you notify the healthcare provider right away. So what is the key to prevention? So measles is preventable with 2 doses of the MMR vaccine. Now your first dose is typically between 12 to 15 months. So you may have already had it, depending on if your parents was for or against vaccines. But more than likely you have your first dose already. Your second dose was 4 to 6 years. You should have that already. 97% effective after 2 doses. The Louisiana requires the MMR for school. So like I said, most of us and even our kids have already been vaccinated. But waivers can be filed. There are some people that choose to opt out, especially here in 2025. There are some patients or some caregivers or guardians that choose to opt out of certain vaccines, so a waiver can be signed. And what that does is that protects the healthcare entity. Just in case there's something happens, they can have that on file saying that the patient, declined getting that vaccine and the reason for that. Encourage caregivers to educate families on why vaccines matter. Now, there's a way you can educate them, and you can provide them with resources. You can't force them, but you can definitely do your part to educate them. Vaccines do not cause autism. Yes, I have had people tell me that. I've had people tell me all kinds of things, that vaccines cause this. That has not been proven to be true. So measles is airborne, so you're going to follow airborne isolation precautions. Make sure you have the proper PPE, which is your personal protective equipment. If it is airborne, then you want to make sure you have face shield, goggles, or at least a mask on, so that you can avoid transmission of the infection. Also, make sure you are washing your hands. That's like the number one thing. Make sure you're washing your hands. So let's talk about some of those myths about the vaccine. So the first myth, vaccines cause autism. That's one that we just went over. There have been, first of all, this is false. There have been multiple large-scale studies that have shown there have been no link between vaccines and autism. The original study that sparked this myth was retracted, and it was retracted for fraud. Myth number 2, natural immunity is better than vaccine immunity. This is also false. Many people want to do things naturally, and I have no problem with that. My specialty is actually more of a holistic care, the holistic and natural route, but I still believe in modern day medicine, and I do not agree with this, and I'm glad that it has been debunked already. The fact is that natural infection with diseases like measles can lead to severe illness, hospitalization, or even death. Vaccines provide safe and effective protection without the risk of diseases. You have to remember that all of these things have been tested over and over and over. So if there's a vaccine for it, my suggestion would be for you to consider getting that vaccine. I'm not going to tell you to get it, but my suggestion, this is only a suggestion, that you follow suit. But myth number 3. Myth number 3. Vaccines contain dangerous toxins. This is false. Vaccines may contain small amounts of preservatives and adjuvants like aluminum, but these are safe and have been regulated in small amounts that are far less harmful than the diseases themselves. So it's very safe. Myth number 4. Vaccinated people still get sick. So what's the point? This is probably one of the most common that I hear. So before I get into it, let's talk about the flu shot. So I hear it a lot with the flu shot. I've heard it a lot with the COVID vaccine. So still got sick. So why we still taking it? Why do we have to take it? Oh, it doesn't work. So according to talking about the flu shot. So most of us in Louisiana, with our good old Louisiana weather, we deal with allergies all the time. A lot of times we deal with it so often that we don't know when it's not just allergies. So let's say you go in to get the flu shot. You've been dealing with allergies because, hey, it's my allergies. I deal with this all the time. So it's just my allergies. Well, you go in, you get the flu. You get the flu shot. And then a couple days later, you're sick. You're having fever, you have chills, your body aches, you're coughing, you're sniffling. Well, you were sniffling before, but you thought it was just allergies. So you may have already contracted or came into contact with someone and contracted the flu and still decided to get the flu shot. I think people don't think about stuff like that because it's just allergies. I deal with this all the time. But it could have been a coincidence that you already had it, Anyway, I just brought that up because this has happened several times. But anyway, the vaccine does not get you sick. That has been false. Vaccinated individuals are also far less likely to get infected. And if they do, the symptoms are usually milder and shorter. It also prevents spreading to others. So you might have something and it may not affect you as much, but if you contract that and you pass it to someone else, it might affect them, more than you. I call it the shock period. When you go in, you get your vaccines, you might feel bad afterwards because your body's adjusting. But it's a short time and then you get over that. That's just my way of looking at it. So what are some of the treatment for the measles? One is supportive care. Hydration, you want to encourage fluids to prevent dehydration from fever and loss of appetite. If it's some children, make sure you avoid aspirin. Avoid aspirin in children due to the risk of Rye syndrome. Rest. Ensure the patient gets plenty of rest to allow your immune system to fight the virus. Number 2 is isolation. The patient should be isolated for at least 4 days after the rash onset to prevent spreading. Make sure you're using airborne precautions. If hospitalized or even at home, make sure you're using an N95 mask. The patient will most probably be in a negative pressure room if possible. Number 3 is nutritional support. Vitamin A supplements are recommended, especially in children, as measles can lead to deficiency. The WHO recommends high dose vitamin A for 2 days because vitamin A reduces the risk of blindness and death, especially in malnourished children. The WHO just stands for World Health Organization. And number 4, monitor and treat the complications. So what are we monitoring for? You're monitoring for any signs of other complications as far as like pneumonia, because the patient may require more antibiotics. You're monitoring for ear infections, dehydration, which can become severe and possibly affect the respiratory system. And then number 5, post-exposure prophylaxis, which is we call it PEP. If someone was exposed to measles but isn't immune, then consider getting them vaccinated. Consider calling the healthcare provider so that we can see what route needs to be taken. And we have a review question. So, a little scenario: a child at a Louisiana daycare has high fever, red eyes, and develops a rash from the face down. The caregiver sees white spots in the mouth. So, the question: what is likely the diagnosis and your priority? If you picked C, then you are correct. The priority is the diagnosis is measles, and the priority is isolate and notify the public health. This concludes our training. You have a wonderful day or evening, whatever time zone you are in, and we will see you next time.